Olsalazine Capsule is used to treat ulcerative colitis, a type of bowel disease. It doesn't cure ulcerative colitis but can help decrease symptoms like stomach pain, diarrhea, and rectal bleeding caused by irritation or swelling of the colon and rectum. It is also used to increase the amount of time between attacks. Olsalazine is an aminosalicylate anti-inflammatory drug and is believed to work by blocking the production of certain natural substances that may cause pain and swelling, such as prostaglandins. The recommended daily dosage and optimal timing for taking this medication should be discussed with your healthcare provider. When taking Olsalazine capsule, it's important to follow your doctor's instructions. Typically, you'll take this medication twice a day, about 12 hours apart. It's best to take it with food or after meals to avoid stomach upset. The dosage will be determined by your medical condition and how well you respond to the treatment. It's also important to stay hydrated while taking this medication, unless your doctor advises otherwise. Drinking plenty of fluids can help prevent kidney stones. To ensure you get the most benefit from Olsalazine capsule, take it regularly at the same times each day. If your condition doesn't improve or worsens, be sure to inform your doctor. If you experience headache, nausea, vomiting, or loss of appetite, make sure to inform your doctor or pharmacist. This medication has been prescribed to you because the benefit to you is greater than the risk of side effects. However, if you experience diarrhea, contact your doctor right away as they may need to adjust your dose or prescribe another medication. It's important to also notify your doctor if you experience any serious side effects such as nausea/vomiting that doesn't stop, severe stomach/abdominal pain, pale stools, unusual tiredness, signs of kidney problems, dark urine, yellowing eyes/skin, or easy bruising/bleeding. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice any symptoms such as fever, swollen lymph nodes, rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed, contact your doctor or pharmacist. Remember that you can always call your doctor for medical advice about side effects. Before using Olsalazine capsule, make sure to inform your doctor or pharmacist about any allergies you may have. Also, let them know about your medical history, especially if you have asthma, nasal polyps, kidney problems, liver problems, or have had radiation treatment in the pelvic area. It's important to be cautious with alcohol while taking this medication, as it may increase the risk of stomach bleeding. Additionally, if you are a parent, it's important to note that children and teenagers younger than 18 years should not take aspirin or aspirin-related medications if they have certain illnesses or have just been vaccinated without consulting a doctor first. Be mindful of sun exposure while taking this medication, as it may make you more sensitive to the sun. Always wear sunscreen and protective clothing when outdoors, and seek medical attention if you experience severe sunburn or skin irritation. If you are pregnant or breastfeeding, consult your doctor before using this medication, as it may have potential risks for the baby. Lastly, be sure to inform your doctor and dentist about all the products you use before having any surgery. When taking Olsalazine capsules, it's important to be aware of potential drug interactions. This means that other medications you may be taking could affect how Olsalazine works, or increase your risk for serious side effects. It's best to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Specifically, Olsalazine may interact with medications such as mercaptopurine and thioguanine. It's important to avoid using mesalamine medications taken by mouth while using Olsalazine. Additionally, Olsalazine may interfere with certain lab tests, potentially causing false results. It's important to make sure that lab personnel and all your doctors are aware that you are taking this medication. When it comes to daily dosage and timing, it's best to follow your doctor's instructions. They will be able to provide the most accurate information for your specific needs. If you suspect an overdose and the person is experiencing severe symptoms like fainting or difficulty breathing, it's crucial to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., residents can reach their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. It is important not to share Olsalazine capsules with others. Your doctor may also perform lab or medical tests, such as kidney or liver function tests, while you are taking this medication. It is important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Olsalazine capsule, take it as soon as you remember. But if it's close to the time for your next dose, just skip the missed one. Don't take double the dose to make up for it. Just take your next dose at the usual time. And make sure to take it on a regular schedule to get the most benefit from it. Make sure to store Olsalazine capsule at room temperature, away from light and moisture. It's important to keep it in a safe place and away from children and pets. When you no longer need it or it expires, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do this. And remember, don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.